new research has found that a large proportion of women and GPs are failing to act on the early signs of ovarian cancer.
Well, fears that this could lead to thousands being diagnosed too late. Dr Nighat is here to share the symptoms that they need to look at. What do we know about it? What do we know about the causes and maybe the propensity for getting it?
Well, if you look at the amount of women who are picked up with ovarian cancer, so 750,000 women, and actually we know and understand very little about it even still, even though there's lots of research that needs to be done in this area. And we've spoken about women's health being under research. So anyone with ovaries is at risk of getting ovarian cancer, and the risk increases with age, but that's not to say younger women can't get ovarian cancer. And that's the most important message to put out there. Even young women can get this. The risk increases if you have an inherited gene, a faulty gene such as the BRCA gene. So Angelina Jolie, which she sort of very put that in the forefront because she talked about her mother having the gene. She got herself tested and she found to have it. For those who have an inherited link to Lynch's syndrome, if you've had bowel cancer in the past, if you've ever had any sort of radiotherapy for any previous cancers, puts you at high risk of getting ovarian cancer. If you've had endometriosis or are currently coping with endometriosis or are diagnosed with diabetes, puts you at a high risk of getting ovarian cancer, as well as if you're overweight and if you smoke. There is some data out there to suggest that women who have drink higher than the recommended amount of alcohol also have a link, but we need clearer research on that.
And how dangerous is it?
It's dangerous because, unfortunately, the symptoms are so non-specific, and I can't tell you how non-specific they are because they get missed. And if they're missed, then a woman who has ovaries says, you know, I'm having these banal sort of symptoms, I can't put my finger on it. And as doctors, if we're not thinking about it as a differential diagnosis, so it's not on our list of symptoms or list of potential diagnoses, then actually we pick it up later on in stage, and usually fourth stage. And that's really quite severe because it means either the disease is spread or it gives a really poor prognosis at fourth stage.
Well, this poll by the charity Target Ovarian Cancer found that those with ovaries are dying of ignorance. But you look at some of the symptoms and think, well, you know, how could you possibly know? 99% didn't know that needing to pee more urgently was a sign. 97% didn't know that feeling full was a symptom. 79% didn't know that bloating was a symptom. The survey also found that 40% incorrectly believed ovarian cancer could be picked up by screening for cervical cancer.
Yeah, so there's a lot of misinformation when it comes to ovarian cancer. The Eve appeal, and I recommend everybody looking at their website, have done so much campaigning around looking up the symptoms. Firstly, I think it's important to just know anatomically where the ovaries are, because a lot of people don't realise where they are. I hope we have a picture on the screen that comes up in a few moments, but essentially the ovaries are linked to the fallopian tubes and they're right into the pelvis. So that's where your ovaries are, next to the womb, and they are sometimes, you can't even palpate them or feel them, so it's usually lower down in the pelvis where you can feel the pain. The symptoms are, as you were saying, bloating, but it's persistent bloating. The thing is that irritable bowel syndrome can have bloating. If you have constipation, can give you bloating. If you've eaten something a bit dodgy that day, that can also give you bloating. But the key thing is 3-week history of persistent bloating. If you feel full quite quickly, if you've had a loss of appetite, if you've had loss of weight and you weren't intentionally looking to lose weight, if you have constipation, if you need frequency of peeing, if you can feel a lump, obviously please get that checked out as well. And this is another sort of symptom that often gets missed, is if you are in the menopausal phase of your life and you've had vaginal bleeding, that must always get checked out. Because they are such non-specific symptoms and they cross over so many other conditions, they do get missed. I, as a GP, because I do women's health, I would say have a high level of suspicion of index to say maybe this could be ovarian cancer. A woman over the age of 50 who suddenly comes to you and she's describing irritable bowel type symptoms, so bloating, feeling full, she might not have weight loss, just think, actually, could this be ovarian cancer? Again, a younger woman in her 20s or 30s who says, Dr. Arif, I've had persistent bloating for about 3 weeks now and it's not getting better and I'm trying to adjust my diet or I'm drinking more and I'm not constipated. Again, have that suspicion of index to say, ooh, could this be ovarian cancer?
So if somebody's watching this at home and they've seen that list of symptoms, at what point do you go and see your doctor?
So usually I always say anything that doesn't feel right to you, but 3 weeks is a good indicator of saying these symptoms have been going on for longer than 3 weeks. Keep a symptom diary, that's really important. So track what your symptoms are doing, track what your periods are doing, also what you're eating as well, how often you're opening your bowels, how often you're going to the toilet. If you've noticed that your clothes are actually getting looser for you and you haven't intentionally tried to lose weight, and if you feel full quite quickly, so you've had a very small meal and suddenly you're full, and that is something that you should be getting investigated pretty quickly. What normally happens after that is, at the minute, I know access to the GPs is quite difficult. So we offer telephone consultations. So say to the, and I give everybody complete sort of permission to do this in a way, because as doctors, we get so many calls. And if you're phoning reception, if you say to the receptionist, I'm having bloating and I think it might be ovarian cancer, have the confidence to say that, because that will flag up to the receptionist, to flag it up to the doctor, and then we'll have that conversation, because we have so many calls that are coming in.
And what are the chances of preventing it? What can you do for yourself to maybe lower your risk?
Unfortunately, if you have an inherited gene or you have Lynch syndrome, it's really difficult to prevent. But lifestyle things all the time. So make sure that you're exercising, keeping your weight down as much as possible. Stop smoking. Make sure you're drinking less than the recommended amount, which is 14 units for men and women. So women, please drink less than 14 units a week. And it's just general good, healthy lifestyle things that you can do at the moment. But there's great news at the moment, because the Eva Peel have funded some amazing research with UCL. So there's a study done from UCL by Professor Martin Witchwenter. They've developed what's known as the WID test. And this is cutting edge. And actually 2 weeks ago, this was all over social media and in the news. And there's a test that you can do. So a woman comes in for a cervical smear. And from those cells, we look at some of the DNA from that cell. So there's a genome project that's going on as part of it. And we can pick up ovarian cancer, breast cancer, womb cancer, and cervical cancer.
One test eventually will be able to...
Yes, and it's incredible.
God,
so this will be so revolutionary, because we can pick it up before it happens. And get this, so the studies have shown that the test can pick up ovarian cancer. So 2/3 of cancers were picked up earlier than they would have done, as opposed to the current diagnostic test. This is from a smear test.
So, in actual fact, that survey that found that 40% of women also incorrectly believed ovarian cancer could be picked up by a smear...
is not inaccurate.
It eventually... That could,
How long?
How long?
So it's in the preliminary stages at UCL at the moment, and the UK at the cutting edge of this, and the Eva Peel have funded a lot of this research, which is incredible. So this is where all that charity money that we collect actually has so much good, and we can be ahead of women actually even getting the cancer, to look at ways of preventing it. And the most amazing thing is that if we could get this done, it will probably be not towards the end of this year, it'll be next year, or the couple of years down the line, then this will be revolutionary about the way we treat cancers, even look at cancers. And the most amazing thing is currently what we do have is a diagnostic investigation test. So if you feel that you might have the symptoms, there's a CA125 blood test or a ultrasound scan that we can do with the GP. So there are things that we can do to help.
Thank you. Thank you very much. Good